What if I tell you that your tongue, it could basically warn you against possible immune deficiencies, vitamin deficiencies, dehydration, or even sometimes cancer? You know, your tongue is basically the dashboard light warning you of your body. Welcome to the Wonder Tooth Podcast. I am your host today, Dr. Radwa Saad. I am, quickly about me, I am a dentist, over 20 years, probably 20 something years. I've been doing dentistry in Canada, in the United States, and I love it. I'm a general dentist, I'm a cosmetic dentist, I'm an implant dentist. I have master's degree in implant placement and restorations, and I am in the state of New Jersey. So if you guys are looking for a good dentist, make sure you follow, like, and share this episode. I also have a blog. If you guys, it's all about dentistry. If you also want to learn more, you can go to blog.donblanchedental.com, and I'm gonna put it in the show notes. Meanwhile, make sure you subscribe, like, and share this episode if you learn something new. But today I'm gonna talk about the tongue and what does it do and why is it very important. And it's basically the entrance of your whole body, and it can tell you a lot of stuff. So first of all, what do we know about the tongue? So the tongue is basically, it's the strongest muscle in your whole entire body. I don't know if you guys knew that, but it's the strongest muscle. So it's made out of muscle, connective tissue, blood vessels, and most importantly, lymphatics. And why lymphatics are important? Because this is what tells you if there is an infection. So these are the lymph nodes that you have down here. It's called the submandibular lymph nodes. For those who are listening to our podcast, we are also on YouTube at donblanchedental.com. And for you guys are watching me on YouTube, so we have the podcast also airs like in Apple Podcasts, Spotify, iHeartRadio. It's everywhere. So you just kind of write the Wonder Tooth Podcast, or you can also find it in the show notes as well. If you're driving, you know, you want to listen to something a little bit, you know, educational and just to get you healthier. Make sure you subscribe there as well. So I'm gonna be talking, but I'm also gonna show things, so make sure you kind of go in between both of them. But lymphatics are very important because this is what tells you if there is an issue in your body. There is an infection, or the lymph node, the submandibular lymph nodes, as I said here, they are basically the lymph node gland. They're like little glands down here under your jaw, the angle of your lower jaw. And basically, if they're a little bit swollen, this is when you know that there is a problem. And also you have the submental lymph nodes down here, and both of these kind of glands, they actually help with teeth and tongue, and sometimes even with the skin. Any skin infection, it can lead to these lymph nodes to become a little tender. So when you go to see the dentist, the first thing, you know, they start to check the lymph nodes to make sure there is no infection. And in certain situations, it can also tell us about if there is some cancer involved. We'll get to this in a few minutes. But basically, the tongue, why the tongue is very important. What can the tongue tell us? So basically, the tongue, it's a red muscle, but sometimes it has different texture, different colors, and different size, and that tells us something. So if you have like white coating on the tongue, so all of you now, if you are listening to me, just go check yourself in the mirror and stick your tongue out and look at it carefully. So if you have a little bit of white coating, that can tell you that, okay, this is mostly, it can go with dehydration, so you're not drinking enough water, or you have thrush, which is the candida, or basically it's a fungal infection. This is most common in people who are on an antibiotic for a longer period of time. So basically the antibiotic kills the good bacteria, and now, you know, the oral cavity, it's a very complex, but it's an ecosystem. So the bacteria, they live in harmony with fungus. So if you take antibiotic for whatever infection, and now the bacteria are like, okay, they're dropping down in numbers, now the fungal, you know, the fungus is like, okay, well, now it's time for me to thrive. And this is when you start to see what's called thrush, or candidiasis, or you know, when you stick your tongue and you see some white patches, and it's also pretty common in people who are immunocompromised. So, you know, people with a lot of medical problems, or people who are wearing dentures or partial dentures, that sometimes could be a big issue, especially if they're not taking them out. They have to. And I have patients who've been like married for like a zillion years, and they never ever take the dentures out at night, and they're like, nope, my husband should not know. And I'm like, okay, but they need to be taken out, because now the problem is your tissues, they need to breathe. So sometimes you get that oral thrush. So this is candidiasis, and how we fix it, you just have to go to see your dentist, and they usually give you like a prescription for an antifungal. And if you're wearing dentures, you have to soak the dentures in that solution as well. And of course, you like, you know, change it every day. But this is oral thrush. So this is, or you know, candidiasis. And what else can cause a white patch? Diabetes can cause white patches sometimes, and this is because it can affect your immune system. So this is another one. But also very important, if you're a smoker and you start to see white patches, they don't go away. So the difference now between a thrush versus something much more concerning is the thrush, you know, you take your medication, it goes away. Or if you actually get a piece of gauze and you start to try to peel it off, like basically try to remove it with the gauze, if it's a thrush, it can be removed. If it's a pre-malignant or cancerous lesion, it will not be removed. And this is sometimes when we start to get very concerned. So if you have thrush or a white patch in your mouth, you have to get that checked immediately. Whether you see your dentist or you go see your primary care doctor, but I would recommend actually to see the dentist, because we are very, very trained, like we're very well trained in the oral cavity. This is our area. So if it's a white patch and it's a malignant patch, it's called leukoplakia. So we get very concerned if that's the case, and this is when you have to get a biopsy done, especially if it's not gone within 2 weeks. 2 weeks is always the standard. So we have a little white patch and we need to get that, you know, under control. We're dehydrated, we're gonna drink water, immunocompromised, we need to take some vitamins here and there. But basically we need to take care of that. All of you guys, make sure you check your tongue today. Then you have the really red, glossy, like it looks like bold tongue, and you look at yourself and it's like, I don't see those little striations in it at all. And that's called basically bald tongue. And that usually happens if you have vitamin deficiency, specifically vitamin B12, folic acid, or iron deficiency. And it's very easy. You just take some supplements, or get some, you know, vegetables, you know, eat some rich, you know, vegetables rich in nutrients, and that should do the trick. You might as well get some blood work done to make sure that, you know, your vitamin deficiency is not linked to something else, because there are other diseases that can cause those deficiencies as well. Then there is the famous one, geographic tongue, and a lot of patients, they come, they're like, oh, that's like, what is that? It looks like a map. It does look like a map, and it's pretty benign. So if you stick your tongue out and you start to see like little almost patches, the thing is with a difference between this and the first one, the white coated tongue, that those patches, they migrate, literally, like the geographic tongue, those little patches, they're gonna keep moving somehow. And this is very benign, it's nothing to worry about, and it's usually linked to stress or, you know, hormonal changes. And you just kind of keep it, you know, simple, a little bit of warm salt water, rinse, that will do the trick. If you really like acidic stuff, it can make it a little bit uncomfortable. So just kind of try to limit, you know, like tomatoes or lemon or lemon water. Try just to limit this a little bit until it heals. So that geographic tongue is pretty common, and it's very benign, nothing to worry about. Then there is the black hairy tongue. Black hairy, yes, there is the black hairy tongue, and that's basically, and it's not because you've been eating like an ice pop or you had a slush. No, this is actually like the filiform, which is, so your tongue has different, like 4 types of taste buds. So the most common ones are the filiform, and they look like, you know, little longer things like this. And basically, if debris start to get stuck inside, or if you are smoker, you know, they start to change in color, and that's basically like almost dead cells. They need to be removed, they need to be scraped off. And how do we do that? This is gonna come after, at the end I'll tell you what exactly you need to do. But black hairy tongue is also very common with people who are immunocompromised, or people who have their HIV positive too. So sometimes that can be one of their, like, basically oral manifestations, and that's because they are immunocompromised. So what else? Well, if you have a little ulceration now or sore on your tongue, so a lot of skin diseases they have oral manifestations, a lot of them. Now, you remember when I said the first time, 2 weeks. So if it's something, you know, that goes away within 2 weeks, we're okay, we should not worry. If it's something lasts more than 2 weeks, or you start to see that it's getting bigger inside, especially an ulcer, you have to seek, you know, dental help immediately, or you have to see your primary care physician immediately. And why is that? Because an ulceration that doesn't heal, it doesn't heal after 2 weeks, that could actually be pre-malignant or beginning of a cancerous lesion there. So this is always a big red flag for us. Always have that checked. Like, don't even wait on, oh, it's gonna be, you have to get that checked right away. If you don't listen to anything I said today, just make sure you get that part 2 weeks, 14 days, and if something kind of lasts after the 14 days, you have to get that checked immediately. Then what else? Pale purple tongue. There is. So pale purple tongue, it's like you stick your tongue out and it's like pale. It's not really vibrant red or pinkish, and that's because we have some sort of anemia going on. Or it could be something like poor circulation in your body to begin with. Or if you have like heart problems or lung problems, that can also lead to this, because, you know, if you're not getting the blood circulation is poor, so you're not getting enough blood supply into the area, and it looks pale. So of course, if you know that you have already heart problems or lung problems, so we understand. If you don't, then maybe you should get that checked as well, like you get it soon. And then some patients, they come and they say, I have a metallic taste in my mouth. I don't know what it is, but I'm like, I have like a bad breath and a metallic taste. If you have that, then we have few things here. So it could be some sort of an infection going on in the body, or in somewhere in the mouth, or you have cavities or something going on. This is one issue. Also, it could be if you have a lot of metal in your mouth, like a lot of silver fillings, the amalgam, you know, the black fillings, these are, you know, they're metal, it's an alloy. Or if you have a lot of like old type crowns, or infection in your mouth, basically because of gum disease, or because of recurrent decay or failing restoration. So you start to get that metallic taste. It can also be if you have dehydration, if you have dry mouth or xerostomia, you have to get that also, like just to try to drink more water. And but sometimes dry mouth could be because of certain medications you are taking, or because you have Sjögren syndrome. What is that Sjögren syndrome? What am I talking about? So Sjögren syndrome is actually named after a scientist, Scandinavian scientist. I think he's Swedish. His name is Dr. Sjögren, and he found that there are certain people who have dry mouth, dry eyes, and arthritis, rheumatoid arthritis, and it's basically they're linked together. So if you have a little bit of dry mouth, a little bit of dry eyes, maybe you can get tested. There is like a gene that you can get tested for it. So, I mean, we spoke about different types of tongue. Now, if the tongue, you start to stick it out and you start to see like almost the shape of the teeth on the side, so that's called a scalloped tongue. What is a scalloped tongue? So that means that the tongue is a little bit bigger than it should, or even worse, that the teeth are starting to shift and you have a lot of crowding, so the poor tongue is like kind of stuck in there, cannot go anywhere. And this is when you start to bite parts of your tongue, and we don't like that at all. So a scalloped tongue, it's usually an indication that you are clenching. You're like clenching, and the poor tongue, there is no way to go, there is nowhere to go to. So it kind of starts to push against the teeth from the inside, starts to push. And this is when you start to see the marks. Or if you have sleep apnea, because sleep apnea is also trying to breathe now, and you're like, okay, what do I do? So you basically clench tight, and then you start to move your lower jaw forward to be able to breathe. And you can listen or watch my, I think I did like a couple of episodes about sleep apnea just to learn a little bit more about it. Then could be also some nutritional problem. But with scalloped tongue, if you start to bite your tongue and basically, okay, you have a big tongue now, and you keep biting on one spot or like specific spots, and then you start to see, remember when I said there is the white patch, the leukoplakia, that doesn't go away, and you start to see like almost a little scar on the side of your tongue that doesn't go away because your tongue is rubbing hard against it. This is the time when you have to see a dentist right away, and they're probably gonna send you to see an oral surgeon. If you start to see that scar that doesn't go away after 2 weeks, remember this is our standard time, 2 weeks. And why is that? Because this could be also beginning of a pre-malignant lesion or even cancer. So a true story, actually I have few, but I'll tell you quickly about one particular case, and I'm actually very proud. I actually saved the patient's life. Been my patient for a while. He has a history of cancer, like skin cancer. He's light, has a light skin color. A very nice guy, but he has crowding, like his teeth are so crowded. And I kept telling him, you have that tooth, it's a molar in the back, it's on the bottom, and it's leaning towards the tongue. And I kept telling him, you keep biting your tongue in that area, that's not good. I told him, you need to get some aligners done, or just kind of to fix the bite. Oh, I'm old now, it doesn't matter, I'm okay. Then one time he came to me and I looked and I said, part of the tongue doesn't look right. I need you to see the oral surgeon, like maxillofacial actually, like right away. And he was like, what? And I said, like right away. So I actually went, and I have a lot of specialists in the area. They're amazing. And I called one of them personally, and I said, I need you to see this patient like right away, today or tomorrow maximum. And I arranged it for him. When he was seen, and it was very, very early stage cancer actually on the side of his tongue. And why is that? Because remember the scalloped tongue and the teeth that were actually completely tilted, and he kept biting that area. And thank goodness it was very early stages. It didn't get to the lymphatics yet, so it didn't spread. So they were able to get that part out, which is like, they took a little piece of the tongue out, but he's still alive. That was like 5 years ago. He still comes to me. He comes every 3 months just to get an extra cleaning, and I'll check, and I fixed that tooth. I was like, that tooth needs to be fixed. I ended up doing a root canal and basically reoriented to put it like more upright rather than sideways. We had to put a crown on it, but at least he's not biting his tongue now. And yeah, every time he comes, he's like, you saved my life. And I'm like, well, I am glad it worked out. So now, how do we care about the tongue in general? So really, I don't want you guys to get the toothbrush and just brush it. Get the tongue scraper. So some of them are like plastic, some of them are metal, whichever you can find. You can buy them over the counter. The plastic ones, they are not really, they don't last for long. The metal ones, you can always clean them, boil them, they are yours. And basically just kind of stick your tongue out and put it and just scrape. And you'll be surprised about the stuff that are coming out. You'll be very, very surprised. And of course, hydration is key. So if you have dry mouth because of certain medications, also make sure you talk to your primary care doctor about maybe adjusting the dosage of something of those, some of those medications. If you have Sjögren syndrome, you have to get that under control. There is a whole lot of over-the-counter stuff that you can actually buy. There is one particular over-the-counter item. I'm gonna write it in the show notes as well. I am not like taking any money or I'm not affiliated with anybody, talking about this, but this is out of clinical, like, what I recommend my patients to do sometimes. Also make sure, you eat healthy. Smoking is a big, it's a big one. So make sure you kind of try to quit, or kind of quit, really, because it's very bad for your body and your health. And you know what I want to say. Diabetes, you have to get that under control for sure. And just kind of most important thing is to get an oral cancer screening. And I usually do this to every single patient who comes to my office, whether it's a 6-month checkup or it's a new patient, or every time I do oral cancer screening. And that's how I was able to save the patient, actually few patients' lives doing that. So oral cancer screening, it's like few steps. You can check on my blog as well, blog.dumblanchedental.com. And you can find a lot of information there about how oral cancer screening is done and how important that is, and how the dentist actually can be the first one, like what I did with my patient, to save your life. Also, kind of check your tongue every now and then. You're brushing your teeth twice a day. I hope you are. So you might as well, when you're scraping your tongue, kind of look, if anything looks funny, or if you have an ulceration that is not healing, or if you have like a sore area that's not healing, or anything that's not healing after in like 2 weeks. 2 weeks is always the time for us. Okay? I hope you learned a little bit about the tongue today, and make sure if you like the episode to subscribe, like, and share, and let me know in the comments here below if you have any questions, or if there are any particular dental issues you want me to address, or even if you want to be a guest on my podcast. I would love that. I would love to hear from people around the world. So I'm very excited. And I'll see you guys soon. So make sure you take care of your teeth and your tongue so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.